Okay, again, good afternoon. I am Rudolf Cymorr Kirby P Martinez, and with me is the one of the leading nurse theorists and one of the theory that I ground my practice with, the theory of nursing as caring. We have with us Ma'am Savina Schoenhofer and Ma'am Boykin. And this will just be a like conversation, not really an interview. So because I do not want it to be like an interview. But nevertheless, I have prepared a slide so that we can read the question. And some of the question actually came from me and from my other colleague who also read your theory and sometimes ask the question to me, but I will tell them I really don't know the answer to this one because I did not write the theory for a while, and I will ask the theorists themselves. So I have compiled all of these questions, and I will be sharing the slide. So again, anyone can actually respond to the queries. So the very first one is actually trying to ask, why did you develop the theory of nursing as caring in the first place?
I'll start. When I was at another university, we studied Orem self-care deficit theory of nursing. And I studied what we call the purple book, the concept formalization book. And it sort of laid out a pattern for what constitutes an adequate, she called it adequate concept of nursing. And so I'd always, and I had a double major in college, and the focus of the discipline of psychology was very clear. The focus of the discipline of nursing was not clear to me. And so that was always one of my passions, was to formalize a conception of nursing that made sense and that had integrity. And then I met Anne. And Anne, you want to take the rest of it?
Well, I was the dean of the nursing program at Florida Atlantic University, where we have studied and grounded and continue to work on grounding the program of study and caring. Well, at the time, Savina was on the faculty, and at that time, our definition of nursing was promotion of the process of being and becoming through caring. And after we had gone through a self-study report, Savina and I engaged in a lot of dialogue on caring and realized that we believed caring was not the means, so it's not through, but that caring was actually the end goal. And so then we decided to put our little heads together and put down the ideas that really mattered to us and that we believed in. And so the theory became.
Oh, okay. So it's now clear why you have developed the theory, because there is actually a need for clarity on the focus of nursing and how caring should relate to nursing as it should be. And that's very interesting. And I did not know Savina had a double major, one in psychology and another in nursing. Actually that thing where you made mention that the discipline of psychology, the focus is very explicit. I did feel that one as well, because when I did my PhD in applied cosmic anthropology, it was very defined. So we can already explicitly say where does anthropology start and where does it end. While in nursing, yeah, I have the same feeling before I read your theory. It seems to be everywhere, and anyone can be a nurse just by being a human person. So that's one of the things that I felt before. So thank you for that response. Let's try another question from our colleague. This one I almost always see this question even with during the journal book club. And the question goes, can a person be still uncaring even by their humanness they are supposedly are caring persons.
Sister Roach says that in our compartment we can fail to care effectively. So that gets at part of that. But Anne, what are your thoughts on the question?
Well, I think that our belief is, I know that our belief is that all persons are at all times caring, that is a fundamental character of being human. That doesn't mean that all of our actions are necessarily caring, that but our being, who we are as person, is always grounded in the belief that all persons are caring. And so when we see acts that we may label uncaring or not caring, and we do see those, that's not a definition of who person is.
Yeah. Okay. So somehow from its purest intent, the person is really caring by nature, but somehow how we express that caringness through our expression may be seen by other person as uncaring.
And we don't
Yes,
always
and-
live up to our nature as caring persons.
And I
We
used
don't
to
always
say,
go ahead.
go ahead, Savina.
No, that was all.
Well, I was just going to say that I think in nursing, I know for myself, and I'm assuming for most nurses, that they have been in situations where it's been very hard to live out their expressions of caring because of an act that the person has committed for whom they're caring. And I used to say to students that they needed to be able to recognize that and to know if they are able to truly come to know a person as caring, and if not, to question then the basis of practice would be doing things versus caring for a person because they're not able to get to the person because of the act. Does that make sense?
Yeah.
Yeah.
Yeah, and a lot of times actually this assumption of the nursing as caring theory, this is the one that a lot of people somehow cannot get their mind across, and they cannot embrace because they have this fundamental belief that somehow there are persons born with a capacity to not care at all, and they somehow assume that there are select people in this world that do not have the capacity to care. But then again, in one of the conversations that we had with Savina, I I think it was another participant who actually said that if you don't believe in this assumption, then follow other theory, because this is one of the fundamental assumption of this theory.
Yeah.
And if the assumption is not aligned with your value that you believe in, might as well look for another theory that somehow resonates with the values that you believe in. But
Or that's a
yeah.
challenge. That's a challenge to nurses to figure out how to come to know the other as caring, even though there is behavior that is presenting a barrier. It's still my responsibility, if I am to nurse that person, to find the caring person.
Yeah.
Does that make sense?
Yeah, it makes sense now.
It's
Yeah.
nursing is a tough discipline and a tough practice, and I think that's what makes it tough. One of the things that makes it tough.
Yes. So let's go to the next question that we have. This one, one of my colleague that's actually is very fond of Martha Roger, actually asked us this question. Is the assumption that the person are whole within the moment similar to the idea of Roger that the person is a unitary being?
We address person as person, not person as a psychological actor or any other dimension of the potential for human expression, but person as person. And I think that gets at the idea of unitary being. What are your thoughts on that, Anne?
I don't see it as the same. I think unitary being, kind of what Savina is saying, it has some different meanings, but you could understand it as a little more fragmented than I think we intend with the idea of person as whole or complete in the moment. So I see some relationships, but I don't see it as the same.
I've always had a problem dealing with the idea of even wholeness, because wholeness implies part.
Yes, yes.
And unitary implies that you bring all those parts together. So you're actually starting from parts. Whereas, and that's always been a problem for me to work out theoretically. Person as person seems to express it for me.
So the perspective of person is that the person is a person, and that person is complete within the moment to
In the
moment.
fullness of personhood, yes. In the
And this
fullness
is,
of what it means to be human.
yes, yes. So we go to the next one. Oh, this one I get this question a lot when especially with nurses working in the critical care, because a lot of Dr. Locsin, majority of the talk of Dr. Locsin will be around technology, and most often than not, he would be addressing his talk with ICU nurses in the Philippines. And I attend some of those lectures, and this is actually one of the common questions that keeps on repeating itself. So what's your opinion on this one? How do you best explain the assumption that a person is complete within the moment, even though that person is in the ICU?
I think it goes back just to what Savina said. The person is person, complete in that moment. Person, the fullness of person is whom you are nursing. You know, you're not nursing a part, you're nursing person.
Much of Dr. Loxing's work today, the papers that he's publishing today, address that very question, because he's talking about replacing parts.
Yeah.
The technological potential to replace almost any part. And at what point do you draw a line between a person and a non-person?
Yeah.
And so, and as you said earlier, he always makes the point that the person is whole, irrespective of appendages being missing or organs being missing. The person is not the piece.
Right.
The person is not the part.
Yeah. I think, ma'am, some of the nurses would find the assumption very difficult to grasp, because their idea of person correlates with the idea of consciousness. And somehow a person in the ICU, majority of them are not conscious. Somehow for them, something is lacking. The expression of personhood somehow with a person that does not have any consciousness. It seems that they are there. They are a person, yes, but somehow they are not completely a person. That's how some of the nurses I have talked to describe their feeling being with another person that is unconscious. They would say that, yes, we know that this is a person and we are caring for this person, But somehow we also know that we feel, not know, but we feel that somehow something is lacking within that person that make them somehow less of a person. Although we know that this is a person, but that is basically how they feel.
The person is still there. I mean, there's a lot of expressions of personhood that I'm not capable of right now, even though I'm conscious. That does not make me less of a person. I think, again, it's the challenge of the nurse finding ways to connect with that person as person, whether they're in a coma or acting out aggressively against the nurse or whatever. Again, it's not easy.
I think it relates to your other, one of the questions you asked was about education and about, so if a nurse has studied what it means to live caring in everyday life, what does it mean to live caring in practice? Then the question that nurse in the ICU might ask is, with a commitment, with a consciousness, as you're saying, and a commitment to living caring, what ought I to do in this nursing situation? And be guided by that firm belief of the assumptions of nursing as caring, for example. So it is really, it's easy to understand why nurses, as you're saying, may identify things as needs or lacks, because that's how we've been taught.
Yes.
A lot of us, rather than looking at the person as whole and understanding what it really means to live caring in practice, in everyday practice, and asking oneself, what ought I to do? How ought I to nurse?
Yeah, that is a very significant question because we rarely get to ask that ourselves. I remember when I was still at the bedside, I think I have not asked that question to myself in my 3 years of experience at the bedside on how ought I nurse. Yeah. Maybe because especially in the Philippines, we majority of the nurses working in the clinical, we have a context that we somehow label as toxic. And I have noticed that in majority of the nurses I have talked to, when I did some studies on the nature of a toxic environment among Filipino nurses, one thing that they focus on when the environment gets toxic is just to exist and make to go through with the 8 hours duty. So the first thing to go is the idea of being reflective in what we do. We just do it as part of the automatic training that we have, so that everyone would not get into trouble. We just need to cover the 8 hour shift and then we move on with our life. But then again, when I entered the academy, this is one thing that I noticed, seeing things from the outside now, looking from the perspective of an outsider. It makes sense to me now that these nurses really looks like they are uncaring because primarily they're trying to just move on within the 8 hour shift and see the person not really as a person, but a thing that needs to be fixed, so that within that time, uh, they can give care to all of the patient that is assigned to them. So somehow, the nurses are does not want to be like that, but somehow the context would not allow them to be the full nurse that they can be.
One way of looking at it is that just get through the day approach is a way of caring for myself.
Yeah.
But it's not an effective way of caring for myself, because I wind up realizing that I'm not living my nursing the way I intend. And in the end, you see nurses burning out.
Yeah.
Yeah.
Because they haven't, like you say, they haven't been offered the environment that would nurture them as caring persons, but rather it sucks sucks a lot of the caring strength, the
Yeah.
caring capabilities.
Mhm.
How can that, what you said about seeing from the outside, when we're teaching nursing, I wonder how we can put more focus on that. Because as I'm thinking, recalling now when I was teaching nursing, the focus is mostly seeing from the inside.
Inside, yeah.
So maybe if we can introduce some opportunities for students to step back with us and help guide them through an outsider's view, some of these issues can be confronted more effectively in nursing education.
Yeah. I actually did that in one of my activity in because we have
Oh,
a course that's Introduction to Caring Science in our university. It's the course that I have created, and we are the only college of nursing that offer that course at the moment. But hopefully others will follow. And one of the tasks that the student needs to do in that course is to analyze a caring moment and an uncaring moment for them, looking from the perspective of a bystander. So they are the bystander, and they are looking from the outside, looking in.
nice.
And then now we try now to explicate what happened, what could possibly go wrong, what did go wrong, and how did the supposedly caring encounter become automatically uncaring, and try to analyze things. It was a very fruitful experience, and
You
we're
should
actually
write that up
writing
and
a
publish it.
we were actually writing a paper out of that activity. We did produce a research out of that one because it was a because because our student is a new batch of student. They came from this breed of students really different from the previous breeds of students that we had. Yeah, they although they are technologically adept, they are more sensitive to things,
Mm,
and the outsider perspective, uh, their perspective needs to be heard and needs to be acknowledged. That's what I noticed with this batch of student. And one part of acknowledging their perspective is that activity really to try to analyze things from their perspective of what happened. And then we try now to compare how did the nurse now in that situation understand what really happened, because we have a lot of perspective in that encounter.
that's great. You know, that's one of Meyerhoff's caring ingredients is alternating rhythm.
You know, when you talk about the students sharing their perspective, when you were talking a few minutes ago too about the toxic environment and whether it be having students in practice and maybe at the end of practice, having them share their story, reflect on this, the care, the in-between experience they had with the patient, and really understand how they and the other person live their caring. And the same, I think, for staff. We know that when the staff's invited to share their stories, like those staff on those floors that you were talking about, or your floor when you were practicing there, to share their story and really understand what is the call from the staff, what are they needing to feel supported and nurtured, and to create an environment that does that. You know, it's valuing the staff and the persons in that environment to do what ought to be done.
Yeah. And I think that's one of the concern in some of the hospitals that I know of in the Philippines. I can only talk for a few of them, but majority of their staff development would tend to focus on skill set,
Sure.
IV insertion, how placement of ECG, manipulation of machines, and rarely do they go into the path of trying to understand the caring moments of this staff member, trying to hear their stories, understanding what it is that they really need from the ground. I rarely hear staff improvement on those side of things, because as one of my friend who is part of the research update of that hospital would say, we consider those things as soft science, and we would want to focus on the hard science. But then I would say, but the soft science, you need the soft science in order for you to stay human.
You know,
The hard
sisters,
science but will not do that to you.
it would be wonderful if we could study those competencies in the context of competency as a characteristic of caring, like Sister Simone Roach talks about. Competency is essential, but put it in the right context, that in order to care for persons, you know, in a caring way, you have to be competent. So that is important. Those skills and having that knowledge and expertise is very important.
I think to me, that's the door that Dr. Loxton's work has opened, to connect technological competency as an expression of caring. And some people are starting to pick up on taking that idea and using it as a link backwards and forwards. But it's that articulating that link, I think, that makes his work so revolutionary, really.
So we go to the next query. Oh, this one is interesting. What makes nursing a unique discipline and profession if, like what Simone Roach argued, caring is not exclusive even to nursing?
That's easy.
Yeah, I know.
Oh, for me, it's easy, because that's what I learned from working with Orem, was what's the focus of the discipline? What's the unique focus of the discipline? And that was really the core around that question, was the core around which we built Nursing as Caring.
So it's really the focus of the discipline that makes it unique, a unique discipline.
It's an explicated statement of focus that will stand up to scrutiny.
So for us, the focus of nursing is nurturing the wholeness of persons through caring, through coming to know them as living caring and growing in caring, enhancing personhood. So that every time we're in a nursing situation, that's why we're there.
Each discipline, expresses caring through their own focus, and the work that is guided by that focus.
Yes.
You know, I think that the part of this question that is also important is that people really understand and study about self as caring person. So it's true that if all persons are caring, what does that mean? That's being caring is being human. So that is not specific to nursing. I mean, that being human piece. So you have to come to study, how do I live my caring in everyday life? How do I grow in my caring? What are my hopes and dreams for growing and caring? To help us better understand then in nursing how others are living their caring uniquely and differently, and to honor and celebrate that. So it is important to talk about the general nature of caring, but also to be very clear on what our focus is as a discipline when we're in practice.
Yeah.
And that's, in this world, that's communicated most clearly in theoretical perspectives.
Yes. Yes, and I would always tell my student that one of the unique nursing is a discipline because we have a unique nursing knowledge. It's only made accessible to those who are trained in nursing. And if you really want to understand what this nursing knowledge is, you have no other route but to understand it through theories. Because theory is the language of the knowledge, and for us to be able to
Yes.
articulate what is this nursing knowledge, you need to understand the theories behind this nursing knowledge. That is always the argument that I put forth with my student when they ask me why do we need to study theory. Besides, of course, that it is required by the curriculum to study, because they need a practical response, not really because it's required. They would ask, why is it required? So this is the shortest way that I rationalize the necessity of studying theory.
It's going back to Meyerhoff's alternating rhythm. You know, it's seeing the whole and seeing the elements of the whole. Like the unique nursing situation is one thing, but how does it connect to another unique nursing situation and another one to make the discipline of nursing? And it's that theoretical perspective that articulates that big picture.
And that's how the knowledge is generated, right?
Back and forth.
Mm-hmm.
Specific to general, specific to general.
Mhm. Now, this one actually is this one is from me actually. The question because in the US you have a different types of nurses, and you have different educational background for nurses as compared in the Philippines. We only have one. We only have the BSN model, and then after the BSN we go to MAMS and then PhD. So in your opinion, will the educational background of the nurse affect their expression of caring?
Savina, do you want to start?
And this is your specialty. Let's hear it.
Well, I guess one thing I would say is every nurse is caring. Every nurse is human. Every nurse is caring and has expressions of caring. Will the educational background of the nurse affect the expressions? Yes, I think that the educational background, when one studies caring and comes to understand self as caring person, understanding how you live caring in nursing situations by studying those situations and reflecting on how you lived your caring with other and how the other lived caring, you grow in the knowledge of yourself as caring and caring in general. So caring is, I believe, an essential domain of nursing knowledge. So caring must be studied. When we talk about the discipline, that's an essential domain of our discipline. So we have to study caring, and yes, through that study, practice changes. I don't know if that, there's a lot to be said about that, but Savina, I'll let you say more and then I'll come back.
Well, I was just thinking about, we claim that caring is the dominant construct in nursing. How many programs of nursing education study caring? Almost none. So there's a disconnect there. We're not living up to our own disciplinary commitment and potential. Like in other disciplines, your introductory course introduces you to the primary concepts in the discipline. and gives, an introductory orientation to those. How many introductory courses of nursing ever mention caring, let alone provide a unit of study on the literature on caring, the caring science, the practice of caring? Almost none.
Which is why it's interpreted as soft rather than a study of caring is of such great depth and substance. But because it's not studied, it's not known.
Yeah, that's actually one of the comments of the students who have undergone the course on Introduction to Caring Science. The course has been ongoing for at least 3 years now. So I always got feedback that before they take the course on the Introduction to Caring Science, they would tell me that caring is caring. So it's an easy concept to understand. And then later on, when we go through the 6-week program, they would just say it's not what we thought it was, because it's really complicated. There's a lot of things to understand, and there's a lot of things that are yet to be understood in terms of caring science. And that's we share the same problem in the Philippines. We are producing a lot of nurses in the BSN. We are producing a lot of professional nurses, but our curriculum that is required for all nurses to undergo, the caring there is not explicit as well. They are just implied, and majority of the times, caring is also only used as the title for the courses in the curriculum. So caring for, and it's not really trying to understand caring as a concept, as a science, as a philosophy. There's none, and it was the very reason why we created the Introduction to Caring Science, because we thought if I have the same perspective as with Savina. If caring is central to nursing, why are we not teaching it as part of the curriculum? Why is it not? Why is the curriculum not grounded on what supposedly is our disciplinary focus according to Newman, which is study of caring in the human health experience? It's not that very particular and explicit. So we created the program. And one thing that's very sad is the caring science will only be introduced to nursing in the Philippines when they reach the PhD level.
Mm.
And it will become more of a theoretical course rather than an actual application of it in the bedside practice, simply because almost all of the nurses getting their PhD in nursing are not in the bedside anymore. So it's a missed
But
opportunity.
if they internalize what you're teaching them, most of them will become nursing faculty, right?
Yes.
And that will filter down, perhaps. I mean, that's the ideal.
Yeah. That's what we hope will happen in the long run. And it was actually a few nursing school who have caring science courses in their PhDs. I only know of at least 3. One of them is St. Paul. Yeah. And another is Siliman, I think. They have
Yeah.
those university where Dr. Locsin used to teach. they have the caring science course.
Where he has influence.
Yeah.
Well, have you read the book Living a Caring-Based Program? It's a book that came from the faculty at Florida Atlantic University. When Anne is she's the inspiration. She had the vision for the total environment. So that in that book, you can read examples of how caring infuses every aspect of the whole college of nursing, from administration to faculty evaluations, to student evaluation, to design of the curriculum, to relationships with clinical agencies. everything entirely, what it means to live a caring-based program through and through. And that's available free of charge. It's no longer printed, but it's available free of charge as a download from the Boykin Institute website.
Oh, I will definitely download that one after this session, so I can read it more. But that's a very good one. Yeah. Now, in this one, Martha Rogers defined caring as the expression of nursing knowledge for the betterment of human life. In your theory, this expression occurs within the nursing situation. So, some of my colleague would want to ask, within the nursing situation, what now is the main goal of the nurse, and how do you now define nursing knowledge? I think we have covered the nursing knowledge part here, but on
That's
the
easy.
main, yeah. Oh.
That's easy. It comes from the focus of nursing.
Yeah.
How do you define nursing knowledge? It's knowledge of nursing persons living, caring, and growing in caring. That's what nursing knowledge is from the perspective of the theory of nursing as caring. And within the nursing situation, what's the goal of the nurse? To nurture persons living, caring, and growing in caring, uniquely in this situation.
Now,
And you go ahead and
No, that's, I mean, that is it.
yeah. One thing that I very much use in the NAC theory is the idea of the uniqueness of every moment in nursing situation. And I used to always tell my student that the moment that you have with the other person is always unique and always exclusive within that moment only. It cannot be replicated again. So we really need to value the sacredness of that moment that you have with the other person. And in the school where I am teaching in San Beda, we're slowly trying to utilize the person first language.
oh,
So
yes.
we're doing away with patient. We always address them
Good.
as persons, and persons living with diabetes instead of diabetic person. It small steps, but somehow my vision is after a long while people will get used to it, and will um the the language will somehow reflect our philosophy of being a caring based institution and utilizing the person person first languages.
Yes, absolutely. And I could just say, we're talking about, we're coming from the perspective of the nurse, a theory of nursing as caring. But if you ask that question of Jean Watson, the way she would answer it would be to state the focus of transpersonal caring, or her theory. Or if you asked Orem, she would state it using the focus of Orem's self-care deficit nursing theory. But that's the role of the explicit statement. You always have home base.
Yeah. Oh, although the answer to this question is already in the book, I've read that part. Some of my some of my colleague would just want to verify if they understood it properly. You have focused much on the idea of the nursing situation being a lived experience between the two persons, and deliberately created for, and within that nursing situation, this is where the nursing expression of nursing occur. Now they would want to just verify who initiate the creation of the nursing situation. Will it always come from the nurse or other person or other discipline as well?
The nurse. the nurse the nurse is the one who authentically and intentionally enters a nursing situation to come to know the other as living and growing and caring, and to nurture them as person living and growing and caring. So but it can occur anywhere, whenever one intends that then nursing happens.
I think part of, oh,
Go ahead, Savina.
we sometimes we use the phrase co-created.
Yeah.
The nursing situation is co-created, but your question is who initiates it. And the concept of nursing situation is a nursing theoretical concept. And as Oram taught, it exists in the mind of the nurse. So a nursing situation is a nursing concept. Therefore, as Anne says, the nursing situation is always initiated by the nurse.
Mm.
The contact, the human contact between nurse and person nursed could be initiated by the doctor or the husband or the person nursed themselves. But what makes it a nursing situation is the nurse conceptualizing it as such.
Mhm.
Mm. No, that clears up thing, because some would understand the nursing situation as really occurring within a specific physical space, when in fact it is a conceptualization of when nursing needs, where nursing could occur.
I think the point you make is good because of telenursing. You know,
Oh,
there's no physical, well, there's vocal, but and that's physical, but there's no touch.
mm.
So yeah, it's a concept.
Mhm.
It's a concept that organizes thinking and action.
Mhm.
Oh, we have tackled this one on the previous question. How can a nurse practice authentic presence in a context where they are almost always overworked?
Well, I can give an example from some research. One of the first research projects that Savina and I did was at an acute care hospital, and it was on a telemetry unit. And so I was to, the goal was to orient staff to nursing as caring and the focus on transforming care, because nurses were running in and out of patient rooms. There was no focus of anything other than to do what you were saying earlier. So I can remember walking on that unit and witnessing that. And I thought, oh my goodness, how will this ever happen? But through a process of intentionally providing staff with materials, with opportunities to dialogue, with being there and hearing their stories, the nurses began to change from hurrying into rooms and coming right out to using what we call direct invitation, to coming to understand that, okay, if I would ask them, how have you nursed? What was your nursing today? And they would talk about doing the things, and then we would dialogue on, is that the goal of nursing? What is the real goal of nursing? And so they came to understand that as being with the person and coming to know the person as caring and supporting and nurturing them. They really got it. And so, yet the time that they had to spend with the patient didn't change. They still only had minutes of time, right? So the process that was critical was they had to learn, how can I change my being with the person being nursed in moments in time to truly nurse? And so one of the, they were clear on what their goal was And one of the parts of nursing as caring is called direct invitation. And so we talked about how would it be if when you went into the room, the person understood that you were there to offer your caring service, but you only had 3 minutes, 5 minutes, and to help you know as nurse what mattered to them in that moment. How can you nurture and support them in that short period of time? And much to the nurse's surprise, the patients responded to that. And the nurses felt and left the floor feeling that they truly had nursed. And in time, that floor had a line of people wanting to transfer to that floor because they were truly nursing. And the nurses were telling their story. And so much changed because they were truly nursing. And they knew it. So I could go on and on about that, but that I know that those environments are hectic, and I know that it can change. It has to be an intentional focus of someone, of a nursing director, of a head nurse, of someone who's grounded in, for example, nursing as caring, and having the dialogue with the staff to create that environment to support them to truly nurse and to hear the stories of how they're not and how that feels.
It would be useful to share how that came about. Where did the invitation to you come from?
I'm trying to remember, Savina, where did it come from?
Well, wasn't it the DON?
Oh, yes.
I don't know for sure.
Yeah, it was. And then it was the director of nursing who wanted to experiment and thought that this unit would be, it was such a fast-paced unit, it would be the highest challenge. And so she engaged this discussion with the head nurse on that unit, whose name was Joe. And he was very, very much a nurse and really wanted to transform this environment, but didn't know how to go about it. So his support was there from the very beginning.
And the central administration support, right?
And the central administration support. Yeah. Yeah. There was actually another hospital where the whole hospital converted to caring as to an understanding of what that means, not just in language, but to caring as a central concept for care in that hospital. And that was just a wonderful, amazing experience because, as Savina's saying, I had the opportunity to meet with the CEOs and COOs and CFOs and all that group around a table and to ask the question, how do they live their caring in their role in everyday work? And so they articulated how they live caring as a CFO or as COO and told their stories. But yeah, but those articles are written, but it was one, I'm so know that it can happen. It just has to take
That's important in transforming the program of nursing education to do similar. Involve the president of the university, the academic provost, the dean of the college, the secretaries of the college, the person who cleans the rooms in the college. Gather them together in small groups or large groups and learn from each one how they live their caring in their work. And that's a really strong, cohesive, I find.
Mhm. You know, just as an aside, I was going to mention this earlier, is when you're talking about caring not being studied except at the doctoral level. You know, when I went to Florida Atlantic University, there was caring was, I can't say it wasn't studied, but it was in a book, but a little bit studied, but not as a main concept, perhaps. But anyway, when I went, we asked the question about what is the knowledge of the discipline of nursing? You know, I knew we were not studying the knowledge of the discipline of nursing. So we really looked at every course that we were teaching and what is the knowledge of nursing that's in this course? Well, let me tell you, there wasn't. There was a lot of knowledge of everything else, pharmacology, pathophysiology, you know.
Medical therapeutics.
Medical therapeutics, like the care of the medical therapeutics. But where was the nursing knowledge? And so we ended up with holes. That was very revealing, and it might be a wonderful exercise. So we had to work. It takes a lot of work. Then, well, what is the nursing knowledge? And then to identify what you believe that is.
It takes an inspiring leader too. And there's inspiring leaders in every setting. You just have to find that person and support them, and you're that person in your environment. I can see that Anne was that person in our environment. It takes a lot of persistence, doesn't it, Anne?
It does.
Over years.
And belief and patience that you believe it's going to happen. And it does. It changes.
Yeah, persistence and patience. It really pays off at the end.
It might be. This is kind of off your topic, but I'm just thinking what gave Anne the support to sustain that persistence and patience when it looked like things were never going to move. That in itself would be a really interesting study, you know, to study strong leaders like Anne and like Nancy Hilton and like you, Rudolph, to see what their sources of support are that kept them in the field.
Yeah, that's interesting to ask and reflect. When all of my colleague and friends at the same generation that I am in, they're all abroad, and only a few of us are left in the Philippines to actually take in the leadership roles. There's actually a vacuum because the generation where we should have been following, all of them are actually not here anymore. So we have the 40s, 30s, 40s, the set, and then we have the missing 50s and 40s. And what we have are the 60s and above. So we have a gap somehow. So yeah, it's somehow it gets a bit tiring, but then again, we need to do something for the profession and the country. So, and I do not have any family to feed, so I just stay here in the Philippines. So that's one thing that I always tell my colleague. I'm single. I basically am I'm contented here, so I need not go abroad, and no one will clean these things. So they might break it down. So I just stay here in the Philippines.
You've got important work to do.
Yeah.
And you have Dr. Loxine back in the Philippines now too.
Oh yeah, but at the moment he is incognito, so he does not want to be known where he is located at the moment. Although I know where he
he
is.
is taking some time off.
Yeah, he's in the incognito mode, but we know he's somewhere here or in the state.
In the world, yeah.
Now, on this one, has the COVID-19 somehow affected the development or expression of the NAC theory in the bedside practice? Was there any issue that you somehow came across in nurses preventing them to be authentically present, or preventing them to nurse the way that they would nurse because of the COVID-19 pandemic and the adjustment to that pandemic after it has been through?
Well, Savina, we've done a couple of articles on that, so I'm going to let you start.
Well, we have worked with 2 different hospitals where that was the specific question. And in one of the hospitals, the IVs were being hooked up from out in the hallway, you know, with the long IV, what do you call it? Tubing. And one of the nurse leaders in that institution, who was grounded in caring, also had the knowledge that transporting medications over that distance was it was problematic. And so she stepped in and disallowed the use of those extenders, so that, and several nurses then had the courage to go in and nurse at the bedside.
Mm.
And from that initial move, all the other workers in the hospital who were engaged with patients who were suffering from COVID began to come back into the rooms in recognition that they weren't nursing those persons from the hallway.
Mm.
That's part of it. There's more to the story than that, but that's part. And what can you?
Well, I think for both of the hospitals, the important thing was hearing the stories of the nurses, you know, the concern for safety, the concern that they may take it home, they may not have the right equipment, and the call for the nurses for these concerns to be heard by the director of nursing or whoever the nurse leader might be. And in the story that Savina is sharing, that chief nurse shared her decision-making with all the directors of nursing and head nurses, and they understood. And then in that story, as well as another example of a nurse who is a phenomenal nurse leader, who again listened to the concerns of the staff nurses and then responded to what mattered to them, responded to what mattered to them, and found that when if the head nurse would go in with the staff nurse and support the staff nurse in providing the care, it built that trust, and that gave them the courage to nurse the way they truly wanted to nurse. And so it was being colleagues, truly being colleagues and working together in this connecting that that made just a huge difference in the 2 COVID units that we know about.
So you really need nursing leaders somehow to step up and be a role model, so that others would have the courage to follow through.
It helps those nursing leaders to have a strong nursing education background. And I'm talking about an education background in caring as the core value of nursing. That really provides a source of strength to nurse leaders, I find.
Now for this one, how do you envision the nursing as caring theory to be in the future? What was the future direction for the NAC theory?
Well, talk about, Savina, the group you're getting together.
Right before the pandemic started, Ann and I decided that we needed to convene a group of people who are working with nursing as caring to look at the developmental needs of the theory. We know that there's some concepts that need further exploration and explication, and we don't really, there may be gaps that we're not aware of that people working with the theory in their practice settings. Well, anyway, the pandemic came along, so we set that idea aside. Now we're trying to revive the idea of getting a Zoom meeting at least going, and having people share, you know, what do you find, what are the developmental needs for the theory? So ask us again in a year and see.
Yeah, I was going to say to be continued.
We
Rudolph,
know that
maybe you would like to.
Go ahead.
I was going to say maybe Rudolph would like to be on that group.
Absolutely.
Oh, I would love to.
Absolutely. We know the concept direct invitation needs to be developed.
Yeah.
Because in the initial iteration of the theory, it didn't exist. And then through this research project Ann was describing, we coined that phrase and discovered that concept. And while it's been integrated into the newest edition of the book and into our, you know, journal publications, we still need to have more exploration of that concept. And we could ask you that question. How do you envision nursing as caring to be in the future? What are the developmental needs that you've experienced? We turn this around and ask you.
Yeah. Yeah. Now, based on how I understood the theory, I've been actually your book is a required reading in the Introduction to Caring Science. So all of our BSN students actually read your paper, also the paper by Meyerhoff and by Roach.
Yes.
So they now know the complexity of the nature of caring and not just a simple act. And I think I would want to further explicate on the idea of the nursing situation and try to find the how what is really the process of expressing the knowledge within the situation that happened between persons. When I did when I created my slides in my lecture, there are some things that for me does not make sense at the moment. So I need to fill it up with concept that I have created, but I'm not really sure if it will make theoretical sense as a whole. So I'm trying to write it out and somehow I will show you the paper. So
Great.
to check if it makes sense, because based on my students' feedback, it makes sense, but I really doubt some of their feedback because it makes sense to them because it's for the simplicity, but somehow I find it lacking still in depth. So I'm still trying to reflect on the idea. And one thing that I have
Wonderful.
done extensively in all of my lecture is try to separate the nursing knowledge from what I call as the ancillary knowledge, the knowledge from the other sciences, humanities, and personal experience of the person, and try to situate how you really express that nursing knowledge through the use of the ancillary knowledge within the nursing situation. Because the student nurses at this day and age would often ask, where is nursing there? And I was like, so what I did was to just separate. This is what we are expressing, and this is how we are expressing it, so that they would understand better. Because they keep on repeating the same question. Where is nursing there? For example,
Okay.
yeah, I'm not teaching. We have a course on pediatric nursing, and they would often go and ask me. I don't teach that course. We have another professor who teaches that course, and they would often ask me, "We don't feel that there is nursing there." It's like everything that we know is from adjunct knowledge. We're the thing that we should be expressing, and I would often ask the professor the same question. So where is nursing in in the course that you're teaching? And yes, the majority of us will be dumbfounded with that question when you really try to ask the professor, where is nursing there in the things that you are teaching? And they would really reflect, yes, where's nursing here? Because we're
You know,
following a curriculum and a course content that has been passed down through the ages with the same generation, and we just seem to replicate it. And I'm trying to not do away with that system, and trying to ask the very basic question: we should be teaching nursing, and where's the knowledge of nursing in the courses that we are teaching?
Well,
Although
that's a
all of
key
the
question,
courses are
isn't it?
required,
you
yes,
know,
we
one
need to
of
be
the,
That's a
explicit.
revolutionary question.
yeah,
It's
one
very
of the,
yeah, it is revolutionary. That's why some of my fellow educators that are my friend, but they are not teaching in my university, would often scratch their head when I try to ask them the same question.
Yeah.
Oh, where's nursing in the things that you are teaching? And for example, they give a talk or a lecture. I would often ask, you give a talk and you claim that it is nursing, but where is nursing knowledge there? And then they would often get confused and reflect on that question, and they were like, oh yes, it seems not to be nursing at all. And that's actually one thing that needs to be improved in how we educate the future professional nurses, is that majority of them would tend to get confused themselves that the ancillary knowledge is the nursing knowledge. So they
It's
would,
never been taught. They weren't given a course in the beginning, very beginning of the study of nursing, theories and systems of nursing,
yeah,
or theories and concepts of nursing. So they never had the language to answer that question.
yeah,
They know how to do, but they don't have the language to answer that question.
yeah,
I'd say you're already started on the ongoing development of nursing as caring. You know, in response to the question on the screen, I think we probably wrote, I don't know if we wrote in the book, but I know that we've written in an article that nursing as caring is built on the work of previous theorists. And some of those theories have been set aside now because there are other theories who express the core of nursing more clearly, or the relationships in nursing more clearly. At some point, there will be another theory of nursing, and you'll probably be the theorist that supersedes nursing as caring, and that's okay. We've done our part, by providing a stepping stone. So it doesn't have to last forever, in my view.
right. You know, Rudolph, one of the things you said is, Savina and I have often talked about studying nursing as it is co-created between the nurse and the one nurse, actually studying that. I think that's, and you mentioned that, and I think that would be very exciting.
I did a study with some nurse practitioners and and the persons that they were caring for. And we would have a triad: the researcher, the nurse practitioner, and the one being nursed. And we discussed the question, how was caring created and how did caring live in your situation? And they spelled it out step by step. And I think we had 6 nurse practitioner, 6 triads in that study. But it was very interesting that when given the opportunity, people can describe how the caring was initiated, what the challenges were, how the challenges were resolved, and what the outcomes, or what we call the value, experienced in the situation. I thought that was really a good process.
Mhm.
Now, I like the point that you have emphasized, Savina, on the theory is not meant to be forever. And when you, yes, that's because I have the same perspective on the things that I always teach, that I won't be the end all of it. You need to do more than what I have done, and I'm okay with just being the stepping stone, and you do the leads, because at the end of the day, I won't be here forever. I won't be here for long. And as long as you are continually improving on the things that we have started, I will still continue to exist somehow. Not really at the center, but on the shadows. But that's okay.
That's beautiful. Mhm.
And our last one is, do you have any message for the nurses in their journey with nursing theories? Because we have known, regardless of what level of education, BSN, MA, or PhD, nurses, majority of the nurses dislike theory for one reason or another. But I don't know. I love theory. It always picked my mind in trying to understand things that seems not not that clear. But again, majority of the nurses would always believe that nursing is really skill based, and I would often argue it's really not. Your skill is an expression of the knowledge that we have. If we are only skill based, then we will be vocational at the end of the day. So, do you have any message for the nurses in their journey in trying to love, or loving nursing theory in their education?
A lot of nursing faculty have never really had a course in nursing theory had a course in why nursing theories. And if the faculty doesn't understand it, the faculty just teaches, oh, here's some stuff you need to know, but here's the real nursing. But just like you and me and Anne, we were lucky enough to have the opportunity to have learned the true value, the everyday practical value of theories. And so for faculty development, I think it's really needed. We don't need to be ashamed of what we haven't been presented with,
I guess my message would be simply that we're called into this privileged profession, and we are there because I'm sure most of us are there because we truly want to respond to calls for care, for caring. And I think for a nurse to live her passion for nursing fully, it's really important that the nurse identify a theory that fits with her values, her belief system, and lives out that theory fully, to the point of advanced degrees, research, and so forth, that, you know, that it's really, really important for that passion. You know, when Savina said before, well, what are the, you know, what kind of holds you in there and the edge of that rug as you're evolving? You know, one of the major things for me is I love nursing and I'm passionate about it. So to find what mattered for me as to live that fully was important. So I think if nurses can study the theories and find what really connects with them, it definitely impacts their journey of practice, whatever that journey is.
So that covers all of the significant questions that we have. And this is the last slide actually. So again, I would like to thank both of you for allowing me to ask those significant questions, and for being the voice of some of the nurse colleague educators in the Philippines, of asking the question for them to the theorists themselves, because somehow some of the questions really are not from me. I just echoed the things that they would want to clarify. And I guess again, that would be all for this session. And I will not forget my next assignment, which is to ask both of you in after a year on the direction of the I will mark that out in my calendar. and I would love to be part of the group on trying to move forward the nursing as caring theory. Again, pleasant day to all, and that ends the recording for this session. I will
Thank you
stop
for
the
this
recording
amazing
now.
opportunity.
Yes, thank you. And it was so nice to meet you. Thank you.